Second. So good afternoon, everyone, and welcome. My name is Carrie Craven, and I'm Administrative Specialist for KCMPA, and we are so glad that you were able to join us today for this webinar. First off, we ask that while the webinar is in progress, that you mute your phone lines to ensure that everyone can clearly hear the presentation. Please press *6 on your phones to mute your lines, or if you're on a cell phone, you can hit the mute button. If you have a question, you can ask it either via the chat window, which is in the bottom of your GoToMeeting bar, or at the end when we open the phone lines for question and answers. Joining me today is Cindy Campbell. She is Director of Clinical Strategies for KCMPA, and she will be giving an update on the new ACO measures. Cindy, go ahead.
Great. Thank you, Carrie. As Carrie said, today's webinar is going to be over the new ACO measures. So if you could go ahead and move to the next slide. And I just thought I'd take the opportunity to do a quick review of the upcoming webinars in the following month. We will be reviewing the quality improvement initiatives at next month's webinar. In April, we're going to be reviewing who our current members are. And then in May, we wanted to do an update on the chronic care management program that KCMPA is currently working on. Next slide, please. So what we're going to cover today in our in the webinar around the new ACO measures are, we're going to talk a little bit about what we need to know now. We'll do an overview, and then we'll talk a little bit about the ACO measure domains, and then we're going to do a deep dive into each of the new measures. Next slide, please. So what we need to know currently about the new measures is the measures did actually start in the year 2015. So they actually started last year. However, they didn't come out until later in the year, and we will automatically get all of the points for the new measures. There was no required tracking for 2015. However, with 2016, we are required to start the data collection for the new measures. So we're going to go over what those new measures are. Next slide, please. Next slide, please. There we go. Okay. So first of all, this is just kind of a quick overview of what the new measures are, and then what the old measures that went away. So I have listed out on the top of this the new measures. So what CMS does is basically they just kind of add the measures to the end, and then the old measures are the number 22, 23, and 24 went away, and that was part of the old diabetes composite. So we now have another 8, I believe it was 8 measures that are added on and 3 that were removed. Next slide, please. Now I'm going to cover the ACO measure domains, and what this means is each domain is kind of a subsection, and the measures all fall into each one of those subsections. And so if you kind of look at this slide and you start from the left and you move to the right, it's going to show what the ACO number is, what the measure is, what's the title, the National Quality Forum number, and then the measure steward. So where are they getting their data from? Where is the best practice and the evidence coming from? And then the very last column there talks about where that data is coming from. So I'll get into that a little bit more. So on this very first screen here on the measure domains, this is going to be the patient caregiver experience. So these are the ACO measures that fall under caregiver experience. And these are all taken strictly from the CAP survey. So the highlighted in yellow is the new measure that was added, and this is a new question that was added to the CAP survey. And it talks about, it asks the question that, of, stewardship of patient resources. And we'll get into a deep dive of that, but that's a new question that was added. So can you move to the next one, please? And then this one talks about the care coordination and patient safety domain. And as you can see, we have quite a few highlighted sections here. And this is really the area that we had the most added measures to. And the majority of this is claims data. So the measures are pulled from claims data itself. If you look down here at the last highlighted on 39, ACO 39, that one is a wireless interface. So the documentation of current medications and the medical record are pulled from HMS, the SQI tool that is located and looking at that information in your EHR. Can you move to the next, please? Can everyone make sure that you have your phone on mute, please? We're getting some feedback. So this is the domain of preventive health, and we did not have any additions to this one, and so this just kind of covers all of those specific measures that fall under the preventive health section, and those are mainly pulled from the wireless interface. These are things that you're actually doing and monitoring and you're recording in the EHR, and so it's being pulled out of your EHR and you're being measured on whether those certain things are being done. Can you move to the next screen, please? And this just kind of follows up from those preventive measures. So this, it's a pretty long list, and I couldn't get it all on one slide. So can you move to the next one, please? And I apologize for kind of the bad quality on this one. I was kind of copying and pasting some pictures on here, but I think it's pretty, you can kind of get the gist of it. This one is the at-risk population, and it has the specific areas for which populations are at risk. So we have diabetes is the first one here, and that lists out those measures under diabetes that were being measured on. With diabetes eye exam is the new one. So this is going to be a wireless interface. So that'll be something that will be charted in the EHR, and then it'll be pulled and monitored from there. And then it goes on to each one: hypertension, ischemic vascular disease, heart failure, coronary artery disease. And then we have depression. So we have the new one that was added in is the ACO measure number 40, depression remission at 12 months. And that's going to be a wireless interface submission as well. So we'll go into a deep dive with that one. So if you want to move to the next slide. Okay, so now we're going to move into a deep dive of each one of these. And some of them are a little bit more self-explanatory than others. And I've also tried to incorporate into this presentation some of those new measures that I've gotten some really specific questions on. And so I've tried to incorporate information around those specific questions just in case you all have those same questions as well. So when we look at our first new measure, ACO number 34, that is the stewardship of patient resources. So that question that's being added to the CAPS is, in the last 6 months, did you and anyone on your healthcare team talk about how much your prescription medicines cost? So if anyone isn't aware, we do use a company that distributes the CAPS and collects that information, the CAPS survey, and they collect that data, and that gets submitted from there. So we really don't have anything to do with that. However, I think it's really good for you all to be able to know what those questions are so that you can incorporate those into your team-based care. And I just want to point out that this question states, does anyone on your healthcare team talk about how much your prescription medicines cost? So I really want to point out that these are not just questions that only the provider or the patient physician is supposed to ask. These are really questions that are geared towards the entire healthcare team. So, and these are something that anyone can be asking the patients. And so whether you create some type of a workflow or roles and responsibilities, kind of look at that and who is asking the patients these questions. And the purpose of this question is really to ensure that we do understand what medications the patients are taking and how much they're spending on their medications. And are we taking the time to, determine, are there alternatives for this patient that would be a less costly alternative? Can you go to the next slide, please? So deep dive for ACO number 35. This is skilled nursing facility 30-day all-cause readmission. So basically described as any readmission of a patient from a skilled nursing facility within 30 days of discharge of the hospital. Can you move to the next slide? And we're looking at the numerator. It would be all of those, any skilled nursing facility beneficiary that it's readmitted within 30 days of discharge. And then the denominator would be all of the beneficiaries that are admitted to a skilled nursing facility upon discharge. Now, there are some exclusions on that. They're kind of lengthy, so I really didn't incorporate them into this specific slide. I think this is pretty self-explanatory. I can also, if anybody wants, I have some more in-depth information that I kind of describe it as the Cliff Notes that goes into more of the specifics around each one of these measures that we can send out as well. I can send out a packet. Can you move to the next slide, please? So ACO number 36, all-cause unplanned admissions for patients with diabetes. So this is basically any patient with a diagnosis of diabetes and they are admitted to the hospital. Can you move to the next slide? So the numerator would be, of course, any unplanned admission of a patient with a diabetes diagnosis, and your denominator would be all of your beneficiaries that have a diabetes diagnosis code within the 1 year prior to the measurement. So they're just looking back at 1 year prior. Can you move to the next slide? Thought I had another. Can you go back up quickly? And I apologize. I thought I had another couple of notes on here. But I just wanted to make sure on this one that everyone realizes that, I've had some questions around, well, is this every diabetic patient? Because, every diabetic patient might have several other things going on. And it is any diabetic patient, like we said, that had that diagnosis code within 1 year prior. Because the way CMS looks at it is that diabetic patients are really, they have so many more issues going on with them and so many more comorbidities. And we're really wanting to look at the whole patient, and that we're not just looking at diabetes, but it's about how we're caring for the diabetic patient as a whole and, trying to prevent hospitalization of this specific patient population just because they have so many more complications. So it is an all cause. And so I just wanted to make sure that I pointed that out. Can you go to the next one, please? And then all cause unplanned admission for patients with heart failure. So same thing, any patients that have, or any beneficiaries that have a diagnosis of heart failure, can you move to the next slide, would be your, and that get admitted would be your numerator, and then your denominator would be any beneficiary with a heart failure diagnosis code, and they had that diagnosis code within 1 or 2 years prior to the measurement period. Your exceptions to this, or your exclusions, would be your patients that are on a left ventricular assist device. Those patients that do not have 12 months of continuous enrollment during the year prior to the measurement year. Those patients that do not have 12 months continuous enrollment in Part A during the measurement year. So there are some exceptions, some exclusions to this. And if you do want this other information that I was talking about that goes into a lot more of the detailed specifics, it will talk about what those exclusions or those exceptions are. It'll go into a lot more detail. Can you move to the next one? And then all cause, I want to always say all cause unplanned admissions for patients with multiple chronic conditions. So ACO measure number 38. And so this would be any patient that is admitted that has multiple chronic conditions. And so if you can move to the next slide, we're going to see on the next slide that CMS has deemed what those multiple chronic conditions would be. So I've kind of listed them out here on the bottom of this slide. There's 8 different chronic disease states that they're looking at. So acute MI, Alzheimer's, or some type of a dementia state, atrial fib, a chronic disease, chronic obstructive pulmonary disease or asthma, depression, heart failure, strokes, or TIAs. So if we have patients that have a diagnosis code with at least 2 of these with an unplanned admission, that would be your numerator. Denominator, of course, would be looking at all of the beneficiaries across the board that have at least 2 or more of these. So if you can move to the next one. And then ACO number 39. I think this is going to be a pretty clear cut. And this is documentation of current medications in the medical record. So this is just ensuring that we have, all of the any type of medications that they're taking. So, the prescriptions or over-the-counter herbals, any type of those medications, and that we are monitoring the name, the dosage, the frequency, and the route of those of administration. And I think we're pretty good about this. I think this is pretty clear cut. It doesn't seem that anybody really has had any outstanding questions around this specific measure. Can you move to the next, please? So depression remission at 12 months. This is ACO number 40. This is one that we have gotten a lot of discussion around because this is really going to be doing a PHQ-9, and then for those patients that were diagnosed with depression based on that initial PHQ-9, and then a follow-up from there. Can you move to the next slide? So I kind of spelled it out a little bit here. So those patients that had an initial PHQ-9 score of greater than 9 and were diagnosed with depression, they would have to come in and at 12 months from that initial date. So there's a 30-day before and after grace period from that initial PHQ-9 when that was administered. And if that second PHQ is less than 5, it's going to be deemed as that patient being in remission at 12 months. So this is really going to be a workflow implementation, designing a workflow to ensure that we're looking at those patients that did actually have a PHQ-9 of greater than 9, and then making sure that we're getting those patients back in that time frame, that specific time frame, and then reissuing the PHQ-9 to determine are they in readmission. And so just, there's been a lot of discussion around what that actual workflow would look like. How do we flag those people? Do we use, some type of a reminders? And, bringing those patients in, there is an additional reimbursement for administering the PHQ-9. So just to kind of keep that in mind. So can you move to the next one? And then, so the last, I believe this is the last one, ACO number 41, is doing the diabetic eye exam. So this is just ensuring that all of the diabetic patients have had up to 75 years of age who are diabetic have had an eye exam by an eye care professional. Can you move to the next one? So per the description that CMS is providing, that this is an eye exam that must be performed by an ophthalmologist or an optometrist. So what I really anticipate is this is going to really take a lot of care coordination with specialists and ensuring that you get that on the patient's EHR, that report, or the checkbox, or whatever it is that we need in order to ensure that you're meeting that specific measure. And I think, so can you move to the next one? So I think that is all we have for the measures. I know that was kind of a quick and down and dirty kind of a review of them. But I really want to encourage you, if you want to, read up and get more in-depth detail, then let me know or Carrie know, and we can get the packet sent out to you. And it just goes into the specifics and the details around each one of those new measures. And like I said, the two that seem to be the ones that I've had more questions around are the all-cause admissions for the diabetic patients, and then the PHQ-9, or the depression remission. So we'll kind of stop right now and see if anyone has any questions. So Alicia, yes, you can definitely get a copy of that packet. We'll send that out to you right after the webinar.
Hey, Cindy, could you send one to Jill Quinn as well? Jane Quinn. I was thinking about Jill Watson. To Jane Quinn with Transcend.
I'm listening to it with Mary.
Absolutely.
Thank you.
Okay, well, if we don't have any other questions, then I'm going to go ahead and end and let you all get about your day. And just as a reminder, our next webinar is going to be March 15th, and we're going to be talking about KCMPA's Quality Improvement Initiative. And all of you have a good rest of the day and a good rest of the week. Thank you so much.
Thank you, Cindy.
Thank you.
Thank you.